Good morning to all fellow participants of 25th International Conference on Research in Life Science and Healthcare. My name is Norhaniza binti Abdul Ghaffar. I'm from Institute for Health Management. Today, I'm going to present my poster presentation on Sepang District Health Office involvement in managing a quarantine center in Sepang. So these are the authors involved in this poster preparation. Overview of the presentation. So there are 4 sections in this poster. Introduction, where we are going to give brief introduction on COVID management by Ministry of Health, Malaysia, specifically in Sepang Health District Office. And then the second section will be methodology. The third section will be result, where we are going to show the main findings on the quarantine center in Sepang, and at the end we are going to explain the conclusion. For introduction, pandemic COVID-19. COVID-19 was first detected in Wuhan, China, and subsequently causing global outbreaks. Due to an emerging numbers of new cases and increased mortality, the pandemic was declared by WHO on 11 of March 2020. In Malaysia, the first case was detected on 25th of January 2020. So, the Malaysian government started to make a travel restriction, test screening for international arrival, and mandatory quarantine procedures in February 2020. Malaysia has imposed travel bans from the main affected areas in China, Italy, Japan, South Korea, Iran, and Denmark at first. Effectively on 18 of March 2020 onwards, the Malaysian government has enforced the first phase of Movement Control Order (MCO) and also published a Federal Gazette that restricts individuals from travelling to other states that have been declared as coronavirus affected areas. Sepang District reported its first case on 2nd of March 2020. A nearby hotel was gazetted as quarantine center under Sepang District Health Office since 9th of April 2020 until that time it was closed on 10th of June 2020. In methodology section, so there are two terms that were normally used uh, during the management of quarantine center, PUS and PUI. Let me explain to you what exactly is PUS. PUS is person under surveillance. Individuals who are subjected to quarantine and issued order for supervision and observation for contact of 2019 novel coronavirus infection under Section 15 (1) Prevention and Control of Infectious Disease Act 1988. Orders will be referred to as person under surveillance. For person under investigations, definition will be a person with fever and clinical sign or symptoms suggestive of pneumonia or respiratory infection with breathlessness and had history of travel to or reside in mainland China within the last 14 days, or close contact with a confirmed case of 2019 and cough while that patient was ill. So this is the flow chart from the start of the opening of the from the uh, for those people who came and arrived in Malaysia until they were discharged or they were allowed to leave the quarantine center after the completion of the quarantine. So all individuals came from the KLIA airport were considered as a person under surveillance and were arranged for quarantine in multiple quarantine centers. PKD Sepang was gazetted to manage a hotel nearby KLIA. All PUS were quarantined in their rooms for 14 days in a hotel under management of PKD Sepang. Nasopharyngeal swabs were taken if any of the PUS had symptoms indicating COVID-19. Then, the PUS together with the samples were sent to Sungai Buloh Hospital. PUI that were sent to Sungai Buloh Hospital were treated symptomatically. If the results of nasopharyngeal swab with samples that were repeated before were negative, they were sent back to quarantine centers and they restarted their quarantine for 14 days. And for those who are positive, will have to stay in the hospital and continue treatment until completion of the quarantine for 14 days. And then, positive cases were notified to District Health Office in Selangor. After completion 14 days of quarantine and results of the COVID test were negative, they were allowed to go home with permission letters from the center. Result. This is the demographic of the PUS that were quarantined in our center from the starting of the opening of the center until the closing of the center, which is from 9th of April 2020 until 10th of June 2020. So for those who age less than 14 were around 13.2%, between age 15 to 24 were around 25.9%, between age of 25 until 44 were around 40.1%, between the age of 45 until 64 were around 18.6%, and for those who are more than 65 years old were around 2.2%. Majority of those who are quarantined in our center were male, around 60.6%, and the rest are female, 39.4%. And majority of the PUS were Malaysian, around 85.7%, and the rest were non-Malaysian, around 14.3%. Number of symptomatic cases, PUI. Total number of those who are quarantined in our center was 719. So around 16 people were symptomatic and were sent to hospital Sungai Buloh for symptomatic treatment, and the rest of them of the PUS were asymptomatic, which is 703 people. Number of positive cases during the operation of the quarantine center. Only 2 cases were positive and were detected in the center. The rest were negative. So for conclusion, declaring a movement control order and following quarantine procedures is an effective measure in curbing the spread of COVID-19, evidenced by the reduction in the number of cases and close contacts since MCO implementation. So that's all from me and my team. Thank you so much for listening to the presentation. I hope that this presentation will be helpful to all of you. Thank you so much.